How long you live could be directly related to your zip code.
UNC Greensboro and Cone Health have joined forces and now have a mobile unit that can meet people where they live. WFMY News 2's Nixon Norman saw how it's serving underserved groups.
Julie and Chad, made possible by a nearly $4 million federal grant, this mobile unit will serve 6 counties in the Triad. From rural to urban communities, the focus is to get health care to those who need it most.
When you look at the northwest part of Guilford County in comparison to the southeast and eastern part of Guilford County, what we see is a life expectancy that can vary as much as 20 years. And that's significant.
This week, Cone Health shared plans at a city council meeting to close the life expectancy gap among different zip codes in Guilford County. It's called the 5 and 5 plan. With different areas having folks live 20 years more in some cases, they want to reduce that gap by 5 years in 5 years' time.
Part of our 5 and 5 strategy is also recognizing that if we keep people well in their communities and at home, then they don't have to come to the hospital. Frankly, the hospital, primarily the emergency department, they're the most expensive places to receive care.
When it comes to meeting people where they're at, that is something that is being taken quite literally. This mobile unit will pop up in parking lots of churches, community centers, and more.
We do have collaborations with, for example, Greensboro Housing Authority, where there are, we could park in that area, and there are people, who could come and get their services with us because we're in a central location. They could walk, they wouldn't have to drive.
Now, starting off, services will be free. The goal is to create partnerships in the community that will allow these services to remain free. Although official ribbon cutting was today, this unit has been out in a handful of communities this summer. It'll serve Alamance, Caswell, Forsyth, Guilford, Randolph, and Rockingham counties.